me introduce the chair of the Children at Risk Institute and the co-editor-in-chief of the Journal of Applied Research on Children, Dr. Angelo Giardino.
Thank you. It's delightful to speak with you this morning about the launching of this new journal. And the question immediately comes up, why a new journal now? Aren't there enough? And when we talked about that, what we felt was we are trying to influence policies that will impact children and families. And what was necessary was a journal that is looking at applied work, real practical case studies that folks who are trying to impact children and families can use and apply and have an influence in their community. And this first issue, we were delighted to find that many of our colleagues in Houston are actually very influential in the national debate and in the national arena on many of the issues that face Latino children. So this is an opportunity for us to highlight the work in Houston, highlight the work in Texas, and also influence the work in the entire United States of America. We have arrayed a wonderful set of authors and a national group of commentators, so I really invite you to read these articles and to find ways to implement the practical impact of these articles in your own communities. Thank you.
Thank you very much. This journal is a product of collaboration. One of our best partners in regards to this has been the Texas Academy of Medicine, the library over at the Texas Medical Center. They have been instrumental in making sure that we have a terrific journal. And then another great partner for this first issue as we focus on Latino children was the University of Houston Downtown's president, Dr. Bill Flores, who has served as our guest editor for the first issue. Please welcome Dr. Bill Flores.
Colleagues that have worked on this, from Children at Risk and faculty here at UHD and Rice, Baylor, and Medical Center. You know, I think this is an important journal. It's an important topic, but it was a great honor to be asked. When I was first approached, would you be willing to do something like this? I was just tremendously honored. Many years ago, I worked in healthcare. I ran some community health clinics that were predominantly Latino. I've worked with children, and I also did research on children's issues. And when you look at how America is changing and the kinds of differential effects that Latino children are facing, not just on the lack of health care insurance, but the lack of specific health care to their needs. You know, right now we're talking about, and the country is very concerned about such things as immunizations. They're concerned about immigration. Well, the two are linked. If kids are afraid of going to see the doctors, they're afraid of going to healthcare, their parents are not going to get their kids immunized. We're going to have people exposed to things like tuberculosis and other diseases. But we also have a rapidly changing population. You know, by 2050, most of the world's industrialized nations are losing population. Germany will lose 42% of its population if current birth rates hold on. China is going to decline by 22% in terms of its birth rate. We're going to increase by 42%. We're going to increase. And almost all of that increase is because of Latino population expansion. So the future of America is very much tied in with the healthcare needs and educational needs of Latino children. If we don't address them, if we don't make them a focus of America and resolving them, addressing them, then we leave the future of America questionable. And we want to be in leadership of these issues. I think this journal is going to play a critical role. So I'm very proud to be
issue on Latino children was written by Dr. Jason Mendoza. Dr. Mendoza is Assistant Professor of Pediatrics at Baylor College of Medicine and authored an excellent article. And please welcome to the podium Dr. Jay Mendoza.
Thank you. It's a privilege to be here. Thanks to President Flores and the editors. Our study looked at a very simple thing, kids walking and biking to school. It's a very common thing that used to happen in the past, but it doesn't happen very often now. And what we found in 8 elementary schools here in Houston is that among our low-income kids, they actually do actively commute to school, so they do walk and bike to school, more than the national average. However, they do not they do not perform fundamental pedestrian safety behaviors like stopping at the curb, looking left, right, left. They're kind of lacking in that. And so the main message is that we need to support our kids in getting them to walk and bike to school, but also to do it in a very safe way. Thank you.
Thank you. And I think Dr. Norma Olvera, who's going to be here, sort of lost her way, but she had an excellent article today in regards to physical activity in our neighborhoods and the need for more things like what Jay is talking about, Dr. Mendoza is talking about, the idea of walking to school being good for kids. We also need to make sure that there are little leagues, that there are soccer leagues, that there are planned activities for many of our highest poverty children, Latino children. It's something that we are absolutely not seeing enough of in our community. Let me bring one last person who is an author, but really I want to bring Dr. Adolfo Santos to the podium, really just to talk a little bit about Latino children. State Senator Letitia Van de Putte from San Antonio, and that will be coming out early next year, the next issue of the Journal of Applied Research on Children. Thank you all very much.